And welcome. Thank you. It's again, I'll say it, Dr. Abdulwaheed. And thank you so much for coming. I know that you are a partner in Lux Dental. Is that the full name, Lux Dental?
Yes, it is.
And you are right near Tom O'Brien and Quincy. That's a good landmark.
Yes.
It's in that strip mall there.
Yes, yes.
There's a few things there, but you have a good size there.
We do.
And you said you had how many dentists?
We have 5 general practitioners. We have 3 pediatric dentists. We have 2 periodontists. They're gum specialists.
Yes.
We have an endodontist who is a root canal specialist. And we're honored to have a doctor that does oral surgery take out wisdom teeth for us. And we have a very, very good team working with us in Quincy.
How long have you been there?
We've been in Quincy for over 3 years.
Are people aware of you? I mean,
people are very, very much aware of us. We are one of the few fully encompassing dental practices in Quincy that accepts Commonwealth Care and Masshealth. So we are a center for dental healthcare access for our community.
And let's find out why you got so interested in this. First of all, you were born in Hong Kong.
Yes.
Which we talked about. I showed you my son-in-law is there a lot. It's the financial capital.
Sure.
And you said other things. What else does Hong Kong have?
Well, Hong Kong is a very diverse community. It has a large number of people from all over the world. We are very diverse in terms of the language, the culture, the religions. It's sort of like Quincy. It's sort of like the South Shore, where we have a diverse population. So having been brought up in Hong Kong, I was exposed to and I was educated to learn and appreciate a different kinds of culture, and allowed me to really incorporate myself in all sorts of environments, which is, I think, very much like Quincy.
Yes. Now, I asked you why you came, and tell us about your education. It's impressive.
I came to the United States originally after finishing high school to attend Tufts University, where I completed my training as a chemical engineer. And then I went on to University of Massachusetts, where I studied physics. And then I moved on and completed my doctoral education at Tufts Dental School. And after that, I continued my postdoctoral training at Harvard and Brigham Women's Hospital, where I was exposed to dental care and dental training for the most compromised, medically compromised, socio-economically compromised. It was a fascinating and experience, having been given the privilege to be trained in Boston and in our state, Massachusetts.
And when you say compromise, first of all, let's talk about the mouth. I was telling you, were telling me the germs, and if you don't take care of your mouth, if you don't go to a dentist, if you say my mouth is fine, I don't think I have a cavity, what happens? I mean,
it's very unfortunate that for many, many years, people are not aware of the importance of oral health. And it's unfortunate that a lot of our medical colleagues are also not as aware as they should be in terms of how important oral health care is. I'll give you a couple of examples. 900,000 Americans die every year from cardiovascular heart disease. 200,000 Americans die from diabetes. All these diseases have demonstrated through research that there's a correlation between oral health and cardiovascular disease and diabetes. The bacteria that you find in plaque and calculus in your gums from the lack of oral health have also been found in people's arteries, in the plaques that are built up in your cardiovascular system. Patients that are diabetics have poorly controlled diabetes when they have poor oral health. Things are hand in hand. If you look at premature deliveries and low birth weights, there's a positive correlation between such issues with periodontal disease. So the mouth and the rest of the body are very obviously interconnected, but unfortunately, our healthcare providers and our society have not been educated sufficiently to realize these importance. For the year 2000, in the Surgeon General's report, they've actually described oral disease as the X factor that can lead to more dangerous, serious, life-threatening diseases. So there's a tremendous correlation that we are aware of, and it's our responsibility as healthcare providers, as dentists and doctors, to educate everybody on this relationship and promote oral health.
Now, this is wonderful. You're a hidden gem in our community.
Thank you.
Now, your issue, not issue, but what you're passionate about is, we talked about Mass Health on the phone.
Yes.
What does Mass Health mean?
Mass Health is a helpline. Mass Health means access for that segment of our community that cannot get access. It's a gateway so that those who really need oral health care can have an opportunity to achieve and get access to the care that they deserve, that they need, especially during these troubled economic times. People are losing their jobs. Those of us who are having trouble finding a job in the first place are ever more dependent on Mass Health in order to get oral care.
Who applies for Mass Health? Do you have to be a certain income?
There is a very diverse requirement and application process.
Okay.
But we're really talking about those with low income. We're talking about those members of our family, our community, our friends who've recently lost their jobs. We're talking about people who
could be us.
Who could be us, who could be any one of us. And these are the people that really, really need it right now. And these are the people who really need this safety net in order to continue a healthy lifestyle, to support them through these hard times. So for me, Mass Health means access to healthcare and oral healthcare, which is pretty much synonymous. These are the same things we're talking about.
Who will stop that? Why will that change?
Because the state of Massachusetts is having a budget crisis, unfortunately, the first group of people that